Hello, my name is Tara Gannon. Today I'll be talking about a WCMICS-led project which established Victoria's first support group for all people affected by head and neck cancer. I'd like to start with a quote from one of our support group members. "I'm sure we have all had those moments, days, weeks, when it's too much. It's too hard and overwhelming to find the way forward. Those moments when we crave our old life, our easy life. But it's gone, it's not coming back." So to me, this quote encapsulates the clear need for this vulnerable patient cohort to access specific peer support from others affected by head and neck cancer. So to provide more context about the initiation of this project, as you may be aware, the Victorian Integrated Cancer Services are tasked with assisting health services to implement the optimal care pathways, or OCPs for short. So our baseline data gathering activities included clinician engagement, patient focus groups, a literature review, appraisal of online information, and an electronic medical record audit. And through these activities, the following was identified. Head and neck cancer affects more than 400 people each year across WCMICS health services. Clinicians reported that newly diagnosed patients always inquire about a support group, and at times an informal process was used to connect patients. Patients themselves reported that peer support would be beneficial, and the literature reported many benefits of participating in a support group, and these included improved psychological well-being, reduced anxiety and depression, improved quality of life, and improved coping and mental adjustment. But more specifically for head and neck cancer patients, there are many quality of life aspects reported highlighting a need for specific head and neck cancer support groups. And these aspects included body image changes, swallowing or eating difficulties, speech or communication difficulties, pain, fatigue, and reduced appetite. So despite these known benefits, an online search revealed the absence of a Victorian-based support group available for all people affected by head and neck cancer, and this is unlike many other Australian states and territories. This then informed a rapid approach co-design process of solution design for the head and neck cancer tumour stream. A WCMICS-led head and neck cancer support group was developed through a series of educational and networking events in July and October 2019. This was followed by an additional launch event in November 2019. At this event, we were joined by Julie McCrossan, who is an ambassador for Head and Neck Cancer Australia, or formerly known as Beyond 5. Across the three events, we hosted a total of 136 attendees, which exceeded our attendance targets. The events explored the requirements and challenges of scaling up to a self-sustaining support group available to any Victorian head and neck cancer patient or carer. It also enabled WCMICS to connect with patients, establish the patient base, and identify suitable facilitators. Two facilitators, one of which being myself, were trained through Cancer Council's support group facilitator training. This was really important to help understand how we can best lead the group in a safe and supportive environment. Collaboration with Head and Neck Cancer Australia and Cancer Council Victoria to host the support group information with a link to our website, and also to undertake the training, as I previously mentioned, has extended our reach to patients and carers, even from outside of the WCMICS catchment. We also partnered with the Peter McCallum Wellbeing Centre to support the group by providing a suitable location in the Wellbeing Centre and communication support. So since the launch event, we've continued to host bi-monthly support group meetings. To date, we've hosted a total of 5 support group meetings since the group's inception. Due to COVID-19, the group transitioned to online meetings using Zoom in June 2020. This has enabled reach across Victoria and of course eliminated commute time and transport costs for all members. We've also welcomed guest speakers from dental oncology, social work and nutrition and dietetics to speak on a particular topic of interest, answer questions and share reputable resources. We are pleased to receive overwhelming positive feedback, including the following comment from one of our support group members. I thought it was very beneficial. The group helps by connecting with others who have shared experiences, good and bad. I think it is also nice to meet people and see them over a long period of time. This has filled a gap in the availability of peer support to head and neck cancer patients and their carers with unique supportive care needs. Thank you for listening.